New liver transplant rules enacted last year to increase access for the most critically ill have instead shifted more organs out of state, forcing Alabama patients to wait longer for life-saving donations, researchers said. The new rules are supposed to help the sickest patients by prioritizing those most in need of a transplant over recipients located closer to a donated organ. But researchers say the system used to measure liver disease favors those living in urban areas with better access to healthcare. It's not great news for states like Alabama and Tennessee, said Ben McMichael, a law professor at the University of Alabama who has studied organ donation policy. The system tends to pit the Southeast and the Midwest against the Northeast and West Coast. The rules that govern transplants are complicated and contentious, and experts disagree about the best way to distribute organs when there aren't enough to go around. Each day, 17 people die while waiting on the organ transplant list, according to the U.S. Health Resources and Services Administration. Patients with the greatest medical need have always had priority access to donated livers, but before 2020, people outside the top tier got first dibs on organs donated nearby. The new rules change the system, creating rings of 500 nautical miles around donated organs and offering them first to the sickest patients in that area. Rates of organ donation vary widely by state, McMichael said. According to a donation report card from 2013, about 61% of Alabamians signed up as organ donors compared to just 20% in New York. People in Alabama are more likely to die from causes such as strokes and accidents, which produce a larger supply of donated organs. Proponents of the new liver transplant rules said geography should matter less than a patient's degree of illness. When the new rules were announced in 2019, several transplant centers across the South and Midwest joined a lawsuit to block them, arguing that the new policy would disproportionately affect patients in the most socioeconomically disadvantaged regions in the country. Doctors use laboratory tests to measure the severity of liver disease, but patients with certain conditions can get exceptions that boost their position on the waiting list. Experts in Alabama said patients in urban areas tend to score higher through exceptions because they have better access to hospitals and specialists, not because they are sicker. McMichael analyzed data from liver transplants between 2002 and 2017. He found that patients scored higher in areas such as the Northeast with fewer donated organs but died more often in Alabama. That suggests the scores don't accurately reflect which patients need organs most, McMichael said. We do have some problems in terms of how we think about the best way to allocate livers, McMichael said.